Good afternoon, everyone, and welcome to COVID-19 Misinformation. What you don't know can hurt you. This is our conversation with CNAs and home health aides and personal care aides, caregivers, agency administrators, and more. And we're really thrilled that the Maryland Emergency Preparedness Network is having the second webinar in our COVID-19 webinar series for 2020. So thank you all for joining. I'm Dr. Charlene Brown. I'm serving as your moderator, and I'm one of the co-planners for this webinar series. Very nice to meet you, and we're glad that you're here. I want to take a moment and thank the Office of Preparedness and Response of the Maryland Department of Health for having the vision to launch this webinar series. I want to thank the Maryland National Capital Home Care Association, also known as MNCA, especially its leader, Dawn Seek, for all of the support and work they've done to make this webinar happen, and my company, Learn Care Together. We really encourage you to sign up to join the Emergency Preparedness Network, EPN. This is the website, and here you can sign up to join the mailing list, where you'll get notices about all of the upcoming webinars over the next several months. We're gonna have 13 more between now and the end of the year. If you are with a home care agency and you're not already a member of MNCA, just go to minca.org to find out more information about joining Maryland and DC's premier home care association. So welcome, everybody. Just to review the upcoming webinars, next week, Thursday, we're excited to welcome Dr. Roy McKay. He's going to talk to us about N95 and other respiratory fit testing. He is one of the nation's experts on fit testing. He's based in Kentucky, and we're thrilled that our remote infrastructure is allowing us to have him share his wisdom and insight with us. On July 30th, we have Dr. Cliff Mitchell from the Maryland Department of Health. He leads the Bureau of Environmental Health, and he's going to be talking about managing chronic conditions in an era of COVID. And finally, on August 20th, we have Dr. Beth Gallick, who's a nurse practitioner and on the faculty at University of Maryland Nursing School, who's going to talk about how she approached dementia symptom management under lockdown. So why are we discussing community misinformation about COVID-19 today? When I'm not working on webinars for you, I run a company called Caregiver Jobs Now, and we have a couple of online communities for nursing assistants, home health aides, and other caregivers who work in senior care and in hospitals. And back in the earlier part of the pandemic in March and April, there was a healthy debate happening among caregivers about whether or not African Americans were immune to COVID-19. And there were very fixed and very strong beliefs in the community. And to be frank, that wasn't just happening here in Maryland, it was happening all over the country. There's a long history of racial myths around disease susceptibility, so it makes sense that people were suspicious. But as we know now, Black people are not immune to coronavirus. What was striking to me about this period was the degree to which the home care agency administrators and staff were completely out of the loop in discussing these topics. They didn't know that their staff may have harbored some of these beliefs. They didn't even know that these rumors were circulating. And so there tends to be a communication gap between employers and employees. And so one of the exciting things about today's webinar is that we have a mix of caregiving professionals and agency administrators on this call, on this webinar. And we're excited to have a really robust discussion about some of the beliefs that are out there and how we can all make sure that we're best equipped to provide care, the care that our clients deserve. And to do that, I'm really thrilled to welcome Adepa Gryn. She is a certified nursing assistant, a Ghanaian immigrant, and an overall amazing human being who I've known for about 4 years now. Has been in the CNA industry, a CNA in the home care industry for many years. She was working in home care and facility care during the pandemic and can speak to some of the misinformation about COVID-19 that she has heard within her West African communities. Is an honors graduate of Montgomery College and actually will be starting online classes as an undergraduate student at the University of Maryland this fall. She worked as a senior caregiver specialist for Caregiver Jobs Now, a role through which she spoke with hundreds of nursing assistants, home health aides, personal care aides, and more about their careers. And so she really has her finger on the pulse of what's going on in the caregiving community. I'd also like to welcome Dr. Lisa Fitzpatrick, who I've also known for, I think, about 10 years now. She's an infectious disease physician and the creator of Dr. Lisa on the Street, where she talks to community members about common health questions and concerns, most recently about COVID-19. So Dr. Lisa is the CEO and founder of Grapevine Health, a company that is focused on delivering health information that communities can trust. She is a CDC-trained medical epidemiologist. She served as a medical director for infectious diseases at the United Medical Center. She has been on faculty at Howard and the GW School of Public Health and has a robust history of several advanced degrees, including an accelerated MD/BA from University of Missouri, an MPH from UC Berkeley, an MPA from the Harvard Kennedy School, and she has authored so many peer-reviewed journal articles. She's been featured in the Washington Post, PBS, Huffington Post. She has served as a diplomat working overseas, and her passion is really focused on engaging people at a community level, making sure they understand health information, as you can see in that picture, and working on improving the quality of care for all of us. So with that, I'm going to start with a poll so we can get a sense of who's in the audience today. Just take a few minutes and figure out which category best describes you. There are 2 questions. If none of them apply, just select other. Okay, just a few more seconds and then we'll wrap up the poll. All right, let's see those results. Okay, so we have a good representation of agency staff and administrators and caregiving professionals. I love it. All right, well, let's see the second question. Yes, the majority of people on the call have known someone who has COVID-19 or who has had it, or perhaps they themselves are a survivor. Thank you so much. So now we're going to take a moment and show a video that Dr. Lisa put together based on some work she did through Dr. Lisa on the Street, where we're going to hear what a lot of people think about COVID-19 symptoms. So stay tuned. All right.
One of the most common questions about coronavirus is, how do I know if I have COVID? Do you know what the symptoms are of COVID?
No, ma'am. The diarrhea, a real hot temperature.
Can you name the coronavirus symptoms?
The symptoms are like fever, nausea, hay fever, I guess.
Okay, so coughing, shortness of breath, sneezing, body aches, and fatigue.
One of the symptoms is fever, headaches. You can lose your taste in food.
Short breath, coughing, and fevers, sweats, right?
Yeah, anything else?
I think vomit too. It's like flu symptoms. Flu like symptoms.
Coughing.
You get heavy breathing symptoms, like you can't breathe, your lungs feel like they're clouded up.
Anything else?
That's all I know.
Have you heard you could lose your sense of smell or taste? No? Have you heard that you could just feel tired?
I didn't know that.
Or you might get diarrhea or some belly pain?
I didn't know that.
Yeah.
The
The most common symptoms of COVID are cough, fever, and having difficulty breathing or shortness of breath. Other symptoms might include muscle aches, feeling tired, having diarrhea, or loss of sense of smell or taste. If you think you have COVID and need assistance with getting a test, or if you have other questions about symptoms of COVID, or any other questions about coronavirus, send us a text message to 202-270-5647.
Okay. Well, thank you, Dr. Lisa. That was fun to watch again. Now we're going to hand over the reins to our wonderful panel of guests. I'm going to start with Ms. Adepa Gryn. I'd like you to start by giving us your reaction to that video and share a little bit about what you've heard about COVID-19 in the communities that you are within. And Amma, you may need to unmute yourself. There you go.
Thank you, Dr. Charlene. Thank you to our viewers, and thank you, Dr. Lisa, for sharing that video. Indeed, it is an eye-opener, as I myself, until I wouldn't say very recently, but about 2 months ago, I didn't have a full understanding of what the symptoms were. For an example, one of my former clients' daughters did not have typical symptoms of COVID-19. She lost her sense of taste and her sense of smell, but she was negative to the COVID-19 test. So I really appreciate the video that you shared to make people aware of what the actual symptoms are. As Charlene already mentioned, my name is Adepa Gryn. I'm a nursing assistant. And when I first heard about the coronavirus, I was working in a rehab facility right here in Maryland. And I really didn't understand what this virus was. I thought it was something similar to the flu. Others attributed it to Ebola. And I didn't really take it seriously, if I'm going to be honest. It wasn't until one day at work when my job instituted a 2 weeks lockdown, preventing all visitors and family from coming onto the site. PPE, extra PPE was made readily available to everyone, but only to be used by those who were working with individuals in isolation. We also started noticing that the second floor was closed to individuals who are not working for the facility themselves. So I was a private duty caregiver, so I wasn't allowed to go on the second floor anymore. The aides and the RNs at the facility, we all scrambled to make a sense of everything that was going on. My church was also closed abruptly without any explanation. And as we were all trying to find out what was going on, making sense of how our lives have changed all of a sudden, unfortunately, some of us fell on some false information, which has become a breeding ground for people to even contact COVID-19 without taking the proper precautions. And I'm hoping that by the end of this webinar, we will be more aware of what to look out for and even take some tips from Dr. Lisa to prevent this virus. So in my circle, I'm going to share in my circle some of the misconceptions that I heard in the beginning. As I mentioned to Charlene in one of our conversations, now I feel like people are getting to understand it better, but I'm only going to share the misconceptions I encountered in the beginning. So I heard stories of how the virus does not affect people of color, especially I would say Black people. And I believe that because this myth was circulated, the Black population was not well prepared for this virus. And that is why the disease was able to infect so many people. When we watch the news or we look at the polls, we see that more people of color have contacted this disease. At the facility that I worked in Landover, more African nurses have died than any other race. So the belief that the virus does not affect Black people is one that needs to be debunked, and more positive news should be shared so that people can understand that it doesn't matter your race, it doesn't matter your gender, the disease can affect you anyway. The other thing that I also noticed, especially in the home care setting, I work both in the facility and I also work in home care. I noticed that my clients started boiling their vegetables and some of their groceries because they felt like the heat was going to kill the virus. One of my clients was actually cleaning her groceries with a solution of water and bleach. And for me, that was so bizarre. It was believed that by cleaning the groceries with bleach, she was killing possible coronaviruses that were on the items. Others were also hoping for summer to come around very quickly because some news media shared the news that the virus cannot breed in hot weather. So as the weather gets warm, the viruses will be killed, which I also believe that it needs to be debunked. And this is very funny because my aunt called me one day and told me that there are actually 3 diseases going around right now. There is the coronavirus, there is COVID-19, and then there is coronavirus S. I mean, imagine my shock. I was so confused and I'm thinking, we haven't even finished dealing with coronavirus, which I explained to her is also the same as COVID-19. There's possibly coronavirus S that I don't even know where to start from. So a lot of people in, I guess, the healthcare, and my aunt is a veteran nursing assistant, by the way, who is actively working. So it goes to show that a lot of individuals in the healthcare system who are working cannot even differentiate between the names of this disease, which are interchangeable. And more education needs to be, shared on that. There was also another myth going around that this disease is a punishment from God. Apparently, some individuals in society have committed such an outrageous crime that God was punishing us. And some other people who felt like they were righteous and did not belong to this unrighteous population felt like that was going to protect them from the disease, which we all know that that is not how COVID-19 spreads. So it put a lot of fear in people, and at the same time, it forced a lot of people to gravitate towards religion, hoping that it was going to save them. The other myth that I also received was people started sending me videos and audios talking about, warning me not to accept any vaccines from anyone. And even in the future, as vaccines come out, because we don't even know when a vaccine is going to come out, not to accept it because it is a ploy by the government, it is a ploy by a certain group of people to destroy a particular race, and the vaccines actually have COVID-19 in them to actually infect you with the disease. And people were actually really scared of this because some people were of the belief that when they receive the flu vaccines, they actually get a little bit of flu. So this might actually be true. And last but not the least, there were several videos that went around. I cannot tell you the number of recipes that I received advising me to mix concoctions made of garlic, lemon, pineapple, hibiscus. I can't even name it anymore because there were so many, mixing all these concoctions and drinking them. My mother called me from Ghana telling me that I had to have steam baths every day, and that was going to prevent me from getting coronavirus. I read on one news outlet that I had to gargle with salt water because the virus lives in my throat, will live in the throat for 4 days before spreading to the lungs. And I believe this, honestly. Now I don't believe it, of course, but I actually felt these were, these news, the things I was reading and what I was hearing was true because I didn't know any better. And I wasn't sure of what way to go. As a nursing assistant, I understand hand washing, and I also understand taking proper precaution, but I wanted to find more ways to make sure that I do not get myself infected with this disease. There is a video that I have, but unfortunately I'm not going to be able to share, of a man who lives in Upper Marlborough that contacted the did not contact the virus, that consumed excess amounts of garlic and ginger to the point where he has actually died. And a friend of mine who lives in Virginia, a very close friend of mine, called me one day, was telling me the horror story about how his wife had to call the ambulance because he was having one of these special steam baths with essential oil and passed out in the bathtub. So there are so many, misconceptions going around. Other people have mentioned about how 5G is the cause of the coronavirus, because even though everything has been locked down, we are still getting sick in our homes. And a whole bunch of other misconceptions that there are. But I'm grateful that in the last few months, an awareness has been created. More people are starting to understand that, in fact, this disease is here to stay and we have to take precaution. But I also feel like there is another population that has become so comfortable with the disease that, they probably still think that because I'm Black, I'm not going to get it, or, I'm going to go pray to God or something. But these are the myths that I actually heard. And yeah, I leave it back to Charlene. Thank you.
Thank you so much for sharing that journey and including examples of things that you believed in the beginning, and the fact that people are still in some ways causing self-harm as they work really hard to prevent the virus. The theme I heard in what you said was that everybody wants to prevent getting the virus, but the belief systems about how to do that are some of which are very incorrect. And that is why Dr. Lisa Fitzpatrick is going to take the reins now and give us a discussion about whether or not some of the things that Amma has been hearing, have you heard these as well in your communications with people in the street? What are the other things that are going on out there? How can we all be aware of what people are believing so that we can deliver the best care? And I'm just going to stop talking because I really want to hear what you have to say.
Thank you so much, Charlene, or Dr. Brown. I don't know if they call you Charlene or Dr. Brown, but either way, thank you for including me. Dr. Charlene. I really appreciated hearing all those misconceptions and the misinformation, Amma. Very, very entertaining. And I actually have a follow-up question before I talk about what I'm hearing on the street. And it's related to the onions or the garlic and what was it? Ginger.
Ginger, yeah.
How do you die from overconsumption? What happened?
There's a video which shows he actually had huge gallons and pots that he was drinking. I believe it was an overdose, but from the video, it showed that they said he consumed too much.
Huh.
Yeah.
Wow. Okay. I would love to see those, because I think it's really important to hear all the misinformation, and not necessarily to judge it, but just to understand the breadth of misinformation out there so that you can help understand where it's coming from and then provide trusted health information so that people know what's true and what's not. The challenge with this pandemic, though, is the information keeps changing, and it's really frustrating for people. I hear that on the street a lot. People say, well, why should I believe any of it? Because even you experts don't know what's going on. And you keep contradicting each other. Or one person says this and the next person says that. And it's true. And I completely understand why people may be skeptical. But at the end of the day, this is still an infectious disease. And we have public health principles. We have infectious disease and medical or clinical principles that are always true when you're dealing with infectious diseases. And so this one is no different. So the basics are very commonly known to us. How do you prevent the flu? Washing hands, covering your sneeze and cough, those sorts of things still apply. That's why we're asking people to wear face coverings. So I think hearing the information, but at the same time, reminding people that it's not completely foreign. It is definitely worse than anything we've seen. But if you just look at the basics of how viruses are transmitted, all that is still there. So I want to encourage you all to leave your questions, because after my comments about what we're hearing on the street, we would love to take your questions. So please start sending your questions. So Ahmed, it's interesting, a lot of the misinformation you've heard, I'm hearing the same. And it's amazing to me, and it's also very humbling, how much misinformation there is out there. At the beginning of the pandemic, back in March, I was furiously trying to answer everybody's questions on social media, people calling me and texting me, and then I got exhausted because it just keeps coming. And I think we have to find a way to manage our own health and our own stress and anxiety while also helping people understand what's going on. So I won't repeat all of the misinformation we're hearing that's similar to yours, but we'll just offer a couple of additional points. You saw the video about symptoms. That is still very common, and the reason it's confusing for people is because that is also changing. If we look at the thousands of people, even the millions of people who contracted coronavirus, still the most common symptoms, if you look at everybody who's gotten it and the proportion of people who have these symptoms, it's still shortness of breath or cough, something to do with the lungs or some sort of pulmonary symptoms, and fever. Fever is still a common symptom. But what we've seen over the last 4 or 5 months is that, and this is the part that's very humbling and very frustrating, a lot of the symptoms can be very minor. So things you saw in that video, feeling tired. I had a father tell me he went to New York to pick up his daughter, and as you know, there was so much coronavirus infection in New York. And when he got home, a couple days later, he felt completely exhausted to the point he could barely wake up or lift his head up off the bed. And then a couple days later, he was fine. But at that time, we were telling people not to be tested. So it's unclear if he had coronavirus, but it's possible that that was his only symptom of coronavirus infection. I also met with the city's medical examiner here in Washington, D.C., and he told me a patient died of coronavirus, but his only presenting symptom was chest pain. And when he got to the emergency department, he was having a heart attack. And sure enough, he had COVID, and he died of COVID, not of the heart attack. So keeping symptoms in mind, sure, the most obvious symptoms may be present, but also look for those subtle symptoms, such as someone feeling random pain they hadn't had before, or maybe just feeling tired or fatigued, wiped out. Now we're hearing that you can have a sore throat associated with it. So I think being on guard when you're working with clients or patients, or even in your family, just paying attention to these subtle symptoms that actually might be early coronavirus infection. The other thing I'm hearing a lot about is the confusion around asymptomatic versus pre-symptomatic. My frustration with saying a lot of transmission is from asymptomatic people is related to the comments I just made about how subtle the symptoms of coronavirus infection can be. So just think about the last time you had a cold or a flu-like syndrome. Before you knew you really had the cold, you may have had a symptom like a tickle in your throat, or maybe you got the sniffles, but you didn't feel bad and you weren't sick enough to stay home. You went on to work or you went about your business, and then a couple of days later you realize, oh wow, I'm sick, I don't feel well. I think this is probably contributing to the rates of asymptomatic infection. Because if people don't have severe illness or feel the need to stay at home, when they get tested, maybe their symptoms are not showing up on the checklist, and then they're deemed asymptomatic. So again, just something to think about. But we won't be able to quantify how many people truly were asymptomatic versus symptomatic. The difference between asymptomatic and pre-symptomatic, in my mind, is no different. Pre-symptomatic just means before your symptoms show up. And that is the same scenario in which you would call someone asymptomatic. So I don't think it's worth having discussions about asymptomatic versus pre-symptomatic, and it only serves to further confuse people and make things more complicated. We hear confusion about testing. In the beginning, we told people not to get a test because we didn't have enough. You may remember, because of challenges with the CDC tests, we didn't have enough tests in the beginning. And so the downstream effect of that was there wasn't enough testing. So we told people, if you're not that sick, stay home and let the infection take its course, unless you need to go to the hospital. This is confusing for people because often people don't know when they need to be seen. This is part of the challenge we have with people delaying healthcare until their health condition is so dire that we get them when they're a lot sicker than they needed to be. So relying on people to decide when they should go to the emergency room is a bit of a challenge for people who have difficulty figuring out when they should go. And in fact, there are several people who waited too late and they decided to go when they could no longer breathe. And by the time they got to the emergency department, they had to go on the ventilator or the breathing machine, or they died. So with these conflicting messages in the beginning about who needs to be tested and who should go to be evaluated at the hospital, it's confused people. Even now, people wonder, well, if I don't have symptoms, should I get a test? Or, well, when should I go and get a test? So we are encouraging people, if they have any concern at all or any suspicion, or think they've been around someone who may have been exposed to coronavirus or who has coronavirus, they should get a test. The other thing we're hearing a lot about is the mask. And Dr. Charlene talked about this a little bit in the beginning. But people are all over the map when it comes to willingness to wear a mask. There are people who say, absolutely, I'm wearing my mask to protect you, and you wear a mask to protect me, and they follow the guidance perfectly. Every time they go in public and they can't be at a distance with people, they wear a mask. And then on the other side of the spectrum, you have people who say, well, I don't think I need to wear a mask because it's not real. So that's somewhat related to what you're saying, Amma, about people disbelieving. But people tell us, I don't know anybody who has coronavirus. Why would I think it's real? Well, how did it just come all of a sudden? First, we didn't have coronavirus, and now everybody's talking about coronavirus. I don't believe I need to pay attention. So that's a challenge, figuring out how you message to people who really don't believe. And I think the best way to do that is to elevate the voices of people who've lost people to coronavirus, or it's for them to hear from people who've had coronavirus so they can tell their story. And so we're starting to do some of that work now, but it's hard to get messages out only through social media. So maybe those of you who are listening, you may have suggestions or ideas, or maybe you can also help elevate stories and share stories of people who have either died or had a loved one who died of coronavirus, or who have been infected with coronavirus. The final thing I'll talk about before we take your questions is the concerns about vaccines. And I'm gonna mention this briefly, but the concern around vaccines, the main two things we're hearing about vaccines are, no, I won't take a vaccine. I don't even get a flu shot. And the second one is, well, maybe I'll take it, but I don't want to be first. And the concern about being first is we're hearing a lot of conversation about this contracted timeline to produce the vaccine. Normally, it takes a couple of years to produce a vaccine, if ever. There are vaccines like the HIV vaccine. They've been working on that for 15, 20 years, and we still don't have a vaccine. But now we're hearing that we might have a coronavirus vaccine by the end of the year or the first of next year, which is warp speed and remarkable timetable. So when people hear that, they think, well, they're making shortcuts, they're experimenting. We can't believe the vaccine is going to work when they're producing it so quickly. So I don't have all the answers about that right now. There's so many vaccines being tested right now, but I'm really hopeful that we will have a diverse sample of people who are in the vaccine study, so that people will feel confident once they see the results. Because once you see that the vaccine is being tested in real people and they're not having side effects or challenges with tolerating the vaccine, then I hope that's going to give people some comfort and ease anxieties around taking the vaccine. But I don't think the vaccine is the only answer. I think this is a very unique situation. I think the combination of having a vaccine, continuing public health guidance around hand washing. We don't seem to be talking too much about hand washing anymore. It's still important. Wearing masks, and I think the guidance around masks is really related to when you are indoors and you cannot practice social distancing, or if you're indoors and there's no airflow or circulating air inside. If you're outside and can practice social distancing, I see less concern with wearing masks. But definitely if you're indoors and you're unable to practice social distancing, a mask is a good idea. People also ask me about the data. Well, how do we know masks works? How do we know masks will work? The challenge is we can't do a research study for every little thing about transmission. We would love to know the answers to all of these questions, but we use our best scientific guess, and so we really rely on people to be community minded. And it's the least we can do to wear a mask if it means our society can open and people can start to resume some normalcy, because that's what we need. My concern is the longer we're in this state of things being closed, it's going to really affect the mental health of so many people. So I'm gonna stop there. Did you come to give me the hook, Charlene?
I sent you a private message.
Oh, I can't talk and read the chat at the same time.
It's okay. We are so grateful for the insights of both Ms. Alma and Dr. Lisa. And I'm just gonna put out a little plug here that we firmly recommend that you follow CDC guidelines about mask wearing and social distancing while considering the judgment calls that Lisa is referring to. I know we have one person who's raised their hand to ask a question, and so Nasen Weisberg, who is the wizard behind the scenes. If you could unmute that person, we can go ahead and hear your question if she's still on if they're still on the call. Is that Deanna? She might have stepped away. Well, while we're waiting for her to come back, we're gonna answer Robin Peake's question. Dr. Lisa, do you recommend one mask over another?
You know, I prefer the surgical mask, and not because I think the surgical mask is more effective at preventing spread from an asymptomatic person, but it's really for the comfort of the wearer. A lot of the cotton masks, so bandanas and homemade masks from cloth or clothing can feel somewhat oppressive after having them on for a while, and they're not as great as handling the perspiration a person might have while wearing the mask. And if you're in that situation, someone may not want to wear a mask in the first place, and then they're having an unpleasant experience wearing the mask. I think to increase the chances or likelihood that people could wear the mask for extended periods of time, the surgical mask is a lot more breathable with the same effect as a cloth mask. And at one point, I know the surgical masks had become expensive. People were exploiting the public by raising the cost of the mask, but I think that's back down to a reasonable price now. And also remember, surgeons and hospital personnel wear surgical masks for numerous hours at a time. And I think it's just more comfortable for the user.
That's a great response. Thank you, Dr. Lisa. We have another question. Is Deanna Beecher, are you ready to ask your question?
Yes.
Hi,
Hi, Miss Charlene. Hi, everybody. I I wanted to know, because I was working in the hospital at one point, and I was kind of skeptical about working there because of that COVID. So is it okay to still work, even in people's homes or anything? Because that's where a lot of the germs are at too.
So the question is it okay to work in people's homes?
Yes.
So every home is different, and I think if you approach it with systematically with steps you can take at each place, it will limit your risk. So wearing a mask, if the person hasn't left their home and they're already through the quarantine period, so let's say you're taking care of someone who's homebound and they don't have relatives coming in and out, I think you'll be okay, but you should continue wearing your mask while you're taking care of that person. But good hand hygiene is essential. And I saw a question on here about, can you wear the same mask? And I think we don't have a lot of science around this question either. But if you're in a situation in which you don't have numerous masks to change them every single day, if you're wearing a cloth mask, you can certainly wash that every day after you finish. But if let's say you have a surgical mask and it's not soiled, maybe you could hang it out. You could hang it so that it can air. Charlene, are you? And then I would say, as a last resort, you could continue to wear the same mask if you have not soiled it. But the other precautions you should take in the home are mostly around cleaning surfaces, keeping your hands clean, wearing a mask.
Thank you.
Thanks, Deanna. I'm going to jump in and just highlight that we had a webinar on personal protective equipment on Tuesday. And just to be really clear that for people who are running healthcare organizations and home care organizations, the message in that webinar and the message now is that you should not be reusing surgical masks. I think what people might do personally is one thing, but I do think that there are a lot of questions about N95 reuse, and there are guidelines about that, but you should not be asking your caregiving professionals that are your employees to be reusing masks, just for clarity.
Yeah, and if they in a situation in which they don't have the extra PPE,
it to be an operation so there's sort of what people do in their day-to-day lives, and then there's like an organization running a healthcare operation, and the need to have adequate PPE and think about your burn rate for PPE and how to make sure you're affording enough PPE. All of that was covered in the webinar on Tuesday, and you can find that on the mdemergencyprepnetwork.org website. There really shouldn't be a circumstance where there isn't enough PPE at this stage in the pandemic if people are planning ahead and are responsible for delivering healthcare in exchange for payment. So,
those are big things, but yes, I hope that's true. I'm still hearing about people who don't have enough, so I hope that's true.
To be frank, I've heard a lot of stories about agencies, home care agencies, doing some very unscrupulous things, like asking the caregivers and their employed to purchase their own PPE, right? That is inappropriate, or not providing enough PPE. So I don't want to further enhance some of the inappropriate things that are happening in the home care industry, and to send a clear message about the importance of protecting your staff and the importance of the lives of the CNAs and caregivers. I think that is a message I want to be really clear about. But we do have some more questions. Let's see, we have a compliment. You're an awesome group of presenters. Each of you is very knowledgeable, informative, articulate, clearly experienced, and have good presentation skills. So go team. We have a message about the best protocol for people working in an office setting. Should we wear masks all day? Is it okay if we are far away from each other? And again, I do refer people back to the recording of the webinar on Tuesday, but Dr. Lisa, do you want to add anything to that?
Yeah, I would love to hear the guidance from the webinar, but I think to be on the safe side, again, if there's circulating air indoors, it's better safe than sorry to wear the mask indoors with groups of people. Yeah,
I completely agree. And Sherry Peach Walker is letting us know that CDC has guidelines on how to properly reuse PPE as needed, basically due to the PPE shortage that has unfortunately occurred. And Mitch, one thing that did come up on Tuesday that we can reinforce here is that almost all PPE was designed for single use, right? Yeah. The intent was always to use even an N95 mask to use it once. But in the context of a public health emergency, like the COVID-19 pandemic, there are guidelines on how to reuse certain types of PPE, and there is guidance from CDC about how to do that. But never forget that all of the PPE was designed originally for single use. And so the intent and the best practice, if there wasn't a pandemic, would be single use for each PPE. And I'm going to scroll down and see what other questions we have. We're just getting compliments. Deanna Beecher says, you all rock and have great advice. And I think, do you have another question? I think you've raised your hand again. No, I think she just wanted to give us a compliment. All right, are there any other questions? I have had my eyes so fiercely peeled on the chat bot and the Q&A, but is there anyone, we're a small enough group that if you have a question that you'd like to ask verbally, we can unmute you and provide you the chance to ask that question, either of Alma or Dr. Lisa. Ah, here we go. Carolyn has a question. Is it true that we inhale carbon dioxide by wearing masks for long periods, or is that another myth? I know that's one that Dr. Lisa would like to answer.
Yes, there's a lot of misinformation out there about this. So again, let me just remind you, surgeons in particular, and now emergency room doctors during the pandemic are wearing a mask all day long. So the symptoms of carbon dioxide toxicity are things like feeling tired, having a headache, you might even pass out, some nausea. So there are some signs of and symptoms for a high CO2. But the most direct answer is no, this is not true, because oxygen and CO2 are both gases. And a gas can easily diffuse across a mask, no matter whether it's the cloth mask from home, even the N95, which is considered a much tighter, more, I would say, obstructive fit. Even in that mask, there's no problem with CO2 retention to the point that it's harmful for you. Because the gas, when you expel it, when you exhale, that's when the CO2 comes out and it's able to escape through the material. So tell your friends, tell all your friends.
Please tell your friends, because that's a common misbelief. We have a question from Roxana, and the answer is yes. Is it necessary to wear a mask outdoors, like when you go for a walk or in a park?
Did you say the answer is yes?
Is it necessary to wear a mask outdoors, like when you go for a walk or in the park? Yes.
Oh, I thought you said
if you're not socially distancing, yeah. And even if you are.
Okay. Right, that's a big if, right? Mm-hmm. So if you are out walking, I think it's really important to carry a mask with you, even if you don't have it on your face, because when you encounter people, the idea behind the mask is I'm protecting you and you're protecting me. So if you cannot practice social distancing when you're outside, it's really important to wear the mask, yes. Fortunately for me, I go outside at 6 o'clock in the morning when everyone else is sleeping. So I have my mask with me, but I don't always have it on because there's no one around. But in general, if there are people around you, I think the best course of action is yes, to wear your mask. And especially if you're indoors, always wear your mask.
Fantastic. Okay, and I'm gonna switch over. I don't see any more questions. I'm gonna switch over and just go through a couple of final slides so that everyone knows about, share screen. Okay. So if we keep moving this forward, I just wanted to highlight a couple more things. We definitely had some great questions, so thank you. And thank you to Dr. Lisa and Ms. Alma. Again, just to remind you about the upcoming webinars next week, N95 mask. This is actually a great place to take your mask questions, also take them into next week's session. And then if you want more information about the Emergency Preparedness Network, MINCA, or Learn Care Together, or if you'd like to follow MINCA on Facebook, these are the ways that you can do it. Big thank you to the Maryland Office of Preparedness and Response for supporting this webinar series. And in our final 5 minutes, I want to go back and ask each speaker to answer a specific question. Oh wait, never mind. I'll save my question because we have another question from the audience. I've seen people with masks with zippers or buttons to close and open. Are they safe?
Really, I haven't seen those, as long as they're closed.
Yeah, don't open them. Interesting, that's a good question, Carolyn.
You know, the other thing I should say about mask wearing is that it needs to cover your face like this, because I see a lot of people wearing their mask like this. And wearing your mask like this defeats the purpose, because coronavirus can enter through your nose or through your mouth. So, or exit. So let's say you're someone who's asymptomatic, but you have coronavirus infection and you only wear your mask over your mouth. When you exhale through your nose, you could potentially release viral particles into the air. So it's really important to make sure you cover your nose and your mouth, and then it's under your chin.
Absolutely. Okay, we're gonna ask one more question of each of you. If you had, and this question's for you, Alma, if you had one piece of advice to share with home care agency administrators that they should pay attention to when it comes to COVID misinformation and being good employers to the nursing assistants and caregivers on their staff, what would that one piece of advice be?
I would say three things. Number one, I feel like the care workers didn't receive enough warning or education about coronavirus. And I want to say that it's not too late, because if you look at the population of caregivers that believed in these misconceptions, I mean, it's alarming. So number one, obviously, to have sort of like an emergency plan for things like this and provide more education for caregivers to set our minds at rest. I work with some caregivers who came to work, all right, were wearing their PPEs, but wouldn't touch a client. And I did not understand. You were better off staying at home. So I felt like we needed more education to understand that the PPE is there to protect you, but this and this and this is also what you can do to ensure that, yes, you're working with the client, but you wouldn't contact the disease. Number two, Dr. Lisa mentioned this already. The deal about wearing the mask properly. There are so many caregivers who are not wearing their mask properly, or even wearing, I would call it the correct form of mask, because they were not provided with, PPE, so they had to come up with their own. So also again, PPE needs to be, made readily available to caregivers so that they're protecting not just themselves, but also the clients who are usually older and more susceptible to the virus. And number three, hand washing. I mean, hand washing is probably one of the first things you learn as a caregiver in nursing assistant training school. But it's funny enough that when I start to count, I realize that I don't even get to 20 and I'm done washing my hands, so yeah, so thanks that I have someone also in my team. So yeah, we need more education about, the proper hand hygiene. Some caregivers think, oh, I use the hand sanitizer. Hand sanitizer shouldn't be a substitute for hand washing. The bottle says it kills 99.9%. Some has only 70% of alcohol, which means it is not entirely, killing all the germs. So we need more education about hand washing, proper use of masks, and also how to be prepared to go onto the field, do what we love, but at the same time protecting ourselves and our clients. Thank you.
Now, you all heard that.
Loving their job. It's such an important job, home care.
Yes.
I'm happy to hear there are people who love it.
Thank you.
I think that's a great way to close. If we can thank all of you for joining this webinar, but also a special thanks to the CNAs, the home health aides, the personal care aides, the caregivers, the CMTs, everybody who is working on the front lines of, and this webinar is focused on home care, but the front lines of home care and the front lines of care during the worst pandemic of our lifetimes. It is such a service to us. And in the midst of all of the busyness and the frustrations, just remember to appreciate the work that they're doing. We're gonna place a poll on the screen now, just asking you what your main takeaway was from this talk. And again, while you're filling out the poll, I want to really extend my deepest gratitude to Dr. Lisa Fitzpatrick, infectious disease physician and specialist, Adepa Gryn, CNA extraordinaire, soon to be college students, actually college student times 2. And I really appreciated your honesty and clarity and advice that you shared throughout this webinar.
Thank you for having us, for having me.
Well, thank you for being here.
Everyone.
Let's see if anyone, we'll give the poll another couple of seconds, and then we'll show the results. And with that, we'll wrap up the webinar session. I hope I didn't miss any questions, but if we did, we apologize. All right, Nelson, I think we can wrap it up. I learned something surprising about community beliefs about COVID-19. Mission accomplished. Thank you, Dr. Lisa and Ms. Ama. We also have 23%, there's a tie, of people who realize they need to provide more COVID-19 education to their team members. So Ama, your message got through loud and clear. And then we have some people who realize that they need more education themselves. So thank you for all of your work during this call, before and after. And with that, thank you all for joining us. We're gonna wrap up the webinar now. Have a wonderful rest of your week. Thank you very much.
Thank you. Thank you all. Bye-bye.
Bye.